The 4-day conference ran under the theme A Transformed Health Education Training and Health Care for Improved Health Outcome and Productive Population was attended by several dignitaries. It was here that the First Lady made the remarks while officially opening the conference.
It is therefore very important that all stakeholders of education and sports and health deliberately rethink and use the theme of the conference to improve training and education. Health workers of today must be competent to tackle and handle medically health conditions accurately within the rapidly changing environment and evolving disease situation. Transformation starts with a renewal of the mind. This calls for change in mindset, in focus and objectives regarding your work and expected outcomes. If this conference is to achieve the objective as expressed in the theme, it starts with renewal of minds.
Mrs. Museveni reminded the conference participants that health service is a calling and not just a job, and called for a transformation of minds where preparators of private health training institutions look at health education and training as a service, as opposed to a business for profit. During the conference, the First Lady launched 4 new curricula for Diploma in Emergency Care, Diploma in Medical Records and Informatics, Diploma in Care and Nursing, as well as Diploma in Pediatric Nursing and Child Health Care.
Attitude should be an important part of our training. A brilliant health worker who lacks empathy is actually a danger to patients. And a health worker who cannot communicate effectively is also a liability to the profession. Training programs for health professionals must incorporate and emphasize interpersonal, communication, leadership, and ethical decision-making skills.
Then there is also this element of overcrowding. There's a hospital where we went to, and you find 30 patients around a patient. Students around one patient. So let's try to put the right numbers. And this can be solved by the issue I talked about. Put the students in shifts. We have 8-hour shifts. If you send me 24 students to my hospital, I can put them in 3 shifts. And then that would mean 8 students are easier to teach than 24 students, because all of them have to be on the ward round.
Mama, there are conditions which are now emerging, and they are a pain. Conditions like stroke, injuries, road traffic accidents, heart diseases, and abnormalities with which children are born. We are seeing that the mortalities were low, but they seem to be stagnating in there. And now that the major causes are moving down, they are becoming increasingly more prominent on our agenda. And therefore, the health workforce we train should now start being oriented from these acute infective conditions to more chronic conditions.
The Education and Sports Minister also launched a fresh census for all academic institutions, both public and private, in the country, which will start on April 7th, 2025. The census, which will be conducted by the Education Ministry in collaboration with the Uganda Bureau of Statistics, is intended to provide accurate education statistics to support planning, budgeting, and decision-making in the sector. Reporting for UBC, Baguma William.